Hey guys, today we're going to be talking about the plantar surface of the foot. This is going to serve as an online lecture for your gross anatomy course. And so we'll start with the sole of the foot, which is a very important anatomical structure. What we know about the sole of the foot is that it's one of the thickest layers of skin in the human body, and that's due to the weight that is continually being placed on the plantar aspect or the soles of our feet, right? If we're standing or if we're sitting, we're still applying pressure to the feet. In fact, the only time that we're really not applying a whole bunch of pressure to the plantar aspect or sole of the foot is when we're sleeping or we're laying down, or our feet are being suspended in the open kinetic chain. So some things about the sole of the foot: it's a sensory organ through which we can perceive the ground while standing and walking. And so what we know about the tissue on the sole of the foot is that it really has adapted to deal with the high local compressive forces on the heel and also on the distal portion of the metatarsals, specifically the metatarsal heads and the phalanges. And so we have a lot of adipose tissue, particularly on the calcaneus, and this is really put in place to allow the adipose tissue to dissipate the force as opposed to the calcaneus itself taking all of those ground reactional forces. And so we'll see another image on the next slide with the thickness of the adipose tissue and why it plays a major role in terms of protecting your calcaneus and the other bony structures on the plantar surface of the foot. And so again, the sole of the foot, really thick, and it's thick for a reason because it allows weight to be continually placed on it without being compromised. So as I mentioned, the plantar aspect of the foot, in particular the calcaneus portion and the distal metatarsal / phalange regions, really have a thick fat pad that engrosses them or that protects them. And major reasons for that is that as the foot makes contact with the ground, generally speaking, unless there's some abnormality or dysfunction in gait, you're going to strike with your heel first. And so this fat pad really absorbs a lot of the forces and the shocks going throughout the calcaneus. And then as we move through the gait cycle and we get ready to toe off, the major anatomical structures that are going to be taking the majority of the weight at that point would be the metatarsal heads themselves, and then also the distal phalanges. And so we see this fat pad as a major protective mechanism. When you begin to incise the plantar surface of the foot, you will appreciate the beauty and the thickness of the actual fat pad on the plantar surface of the foot. So with that being said, weight of the body is transmitted to the talus from the proximal tibia and fibula, right? And then from there, weight of the body is then transmitted from the talus to the tuberosity of the calcaneus. And what we know about the tuberosity of the calcaneus is that it serves as the major attachment site, not only for the plantar fascia, but also for the abductor hallucis, the flexor digitorum brevis, and the abductor digiti minimi. And these are all the first intrinsic layers of the plantar aspect of the foot. And so before we get to those muscles, let's just spend a little time on the plantar fascia. The plantar fascia, or the plantar aponeurosis, as you know it, is a really strong layer of white fibrous tissue, and you will see this fibrous tissue as you begin to incise and dissect the plantar surface of the foot. But it's very strong white fibrous tissue located beneath the subcutaneous tissue and also located beneath the actual fat pad of the calcaneus and then also of the metatarsals. And so towards the forefoot, the plantar fascia kind of divides into 5 sections. So 1, 2, 3, 4, and 5, and then each of those extend into a digit and kind of straddle the flexor tendons a little bit. But some things that I'm learning as I begin to teach this class is that, number one, this is the central portion of the plantar fascia, but the plantar fascia is really divided into what we would call 3 different sections. And so one of those sections Right here would be the lateral plantar fascia, and then you have the medial plantar fascia here, and then last but not least, probably the most important portion of the plantar fascia would be the central portion. And it's the most important structurally and functionally, because it really adapts or allows the foot to become very adaptive in nature, whether that become a flat foot or a rigid foot. It is the plantar fascia that plays a major role in the foot's ability to become adaptive in nature. On the medial slip, or the medial section of the plantar fascia, its major role is that it's going to overlie the muscles that are responsible for providing movement of the hallux, whether that be into flexion or into abduction. And then on the lateral section, that lateral section overlies the muscles that supply the digiti minimi, or are responsible for producing movement of the fifth ray. So now that we've talked about the sole of the foot and its major roles, and then we've talked about the plantar aponeurosis, it's only fitting to really talk about the 4 intrinsic layers of the feet. And so what I wanted to do is really use an app to really show you guys the 4 layers of the foot. And so what we're going to do is kind of make the foot move to the plantar surface of the foot, and we'll start with the first layer of the foot. And the first layer of the foot houses the abductor hallucis tendon, which is right here. It houses the abductor digiti minimi, which is right there. And then last but not least, it houses the flexor digitorum brevis. And the flexor digitorum brevis is responsible for flexing, causing flexion of the lateral 4 digits, so digits 2, 3, 4, and 5, and it's has an attachment on the medial calcaneal tubercle, and then it has slips onto the middle phalange of digits 2 through 5. So this would be the flexor digitorum brevis. And so the first layer again of the foot is comprised of the abductor hallucis, which is here. We've got the abductor digiti minimi, and then last but not least, we have the flexor digitorum brevis. All of them are responsible really for causing some form of flexion to the rays 1 through 5. If we really want to be more specific, we would say that the abductor hallucis tendon major role is abduction, right? Movement away from the midline of the hallux. And then if we wanted to look specifically at the abductor digiti minimi, its major role is flexion of the 5th digit, but also abduction of the 5th digit as well, so movement away from the midline. And then the flexor digitorum brevis major role is flexion of the lateral 4 digits. So that's the first layer of the intrinsics of the feet. What's interesting about the 4 layers is that there are basically 20 muscles that kind of create movement on the dorsal and plantar surface of the foot. And of those 20 muscles, 14 of them are on the plantar surface of the foot. So the plantar surface of the foot, the muscular intrinsic, are very important. Clearly, because we have 14 muscles on the plantar surface of the foot. So if we were to remove a layer, we would be going into the second layer of the foot. And here's where we'll talk about the 2 muscles that are housed in the second layer. So as we remove the first layer and we go into the second layer of the foot, what you will see are the 2 muscles that are housed in the second layer of the foot. And that first muscle that's housed in the second layer of the foot is the quadratus plantae. And the quadratus plantae is this guy, or plantae is this guy right here. And its major role is to assist the flexor digitorum longus in flexing the lateral 4 digits of the foot, so digits 2 through 5. So it's an assister of toe flexion for the flexor digitorum longus. So the quadratus plantae is one muscle in the second layer. The other muscle in the second layer, or muscles, group of muscles, are what are called the lumbrical muscles. And the lumbrical muscles Their major responsibility is flexion of the proximal phalanges, okay? And then they also assist in extending the middle and distal phalanges of, guess what, the lateral, the lateral 2 through 5 digits, or the lateral 4 digits of the foot. And so let me highlight those muscles for you. This is what we consider to be lumbrical number 1. Lumbrical number 1 is right here. This is lumbrical number 2, lumbrical number 3, and then lumbrical number 4. Notice that each of these muscles sits in between 2 digits. So lumbrical number 1 is going to help assist in flexion of the proximal phalanges and extension of the middle and distal phalanges of digits 1 between digits 1 and 2, and then lumbrical number 2 will assist with the flexion of these two guys, lumbrical number 3, and then lumbrical number 4. The lumbricals should not be mistaken for the flexor digitorum longus, which is this tendon right here. Okay, so this is the flexor digitorum longus tendon. Should not be mistaken for that. It is this muscle belly here, this muscle belly, this muscle belly, and this one here. So 2 muscles in the second layer of the foot. Number 1 would be the quadratus plantae, which is here, and then number 2 would be the lumbrical muscle group as a whole. And as we begin to remove layers, we would move into the third intrinsic layer of the foot. Okay guys, as we move to the third layer of the foot, before I actually remove a layer of muscles, one muscle that I wanted to draw your attention to that is in the actual third layer of the foot is the flexor digiti minimi. And the reason I'm going to do this before I remove this layer is because when I remove this layer, it also gets removed from this particular app. And this right here is the flexor digiti minimi muscle. Its major role, as the name implies, is really flexing the proximal phalanx of the fifth, and then thereby basically assisting in digiti minimi flexion. And so again, this would be the flexor digiti minimi. It has a proximal attachment to the base of the fifth, and then it also has a distal attachment to the proximal phalanx of the fifth metatarsal. So now what I'm going to do is remove a layer so that we can see the other 2 muscles that are housed in the third layer of the foot, and those 2 muscles are the flexor hallucis brevis and the adductor hallucis. So if we were to blow this up a little tiny bit, this muscle right here would be the flexor hallucis brevis. Its major role is flexing the proximal phalanx of the first metatarsal. It has proximal attachments to the plantar surfaces of the cuboid and the lateral cuneiforms. And then the second muscle that we haven't talked about that is in the third layer is what is called the adductor hallucis, and there are 2 heads to the adductor hallucis. The first head is the oblique head, so it's here, the oblique head, and then the second portion of that is the transverse head of the adductor hallucis. The major role of the adductor hallucis is exactly what the name implies. It's adduction of the first ray, but the awesome thing about the transverse head is that it's also going to assist in maintaining that transverse metatarsal arch. And so again, 3 different layers in the third layer of the foot. So I'm going to add a layer back in. What the first muscle that we have is the flexor digiti minimi, and then if I were to remove a layer, we would have the flexor hallucis brevis, which is here, and then we would have the 2 heads of the adductor hallucis tendon. Number 1 would be the oblique head, and then number 2 would be the transverse head. And remember, the transverse head is not only responsible for adduction of the hallux, it's also responsible for helping maintain that metatarsal arch. Okay guys, so we've been through muscular layers 1 through 3, and the last layer, if we were to remove the layers of the foot that we would talk about, would be the 4th layer, which houses basically 2 sets of muscles. So there are two muscles on housed in the fourth layer of the foot, and they're going to kind of be difficult to see in this app, so I will do my best to kind of draw them in. And those muscles are the plantar interossei and the dorsal interossei. And so for the plantar interossei, you're going to have three muscles, and so this would be plantar interossei number 1, plantar interossei number 2, plantar interossei number 3. And so I'll kind of draw in their tendinous slips so you can get an appreciation for them on the foot. So those are the plantar interossei, and their major role is to adduct digits 3 through 5. So they are adductors of the digits, so digits 3 through 5. And then they also assist in flexion of the metatarsal phalangeal joints, or the MTP. So if I remove those, then what we will see in just a second is that we also have these muscles called dorsal interossei, and I will try my best to draw them in for you guys. But the dorsal interossei are here, and here, here, and here. There's a really good picture of them in your anatomy book as well, so I probably would refer to your anatomy book in this case. But here are the dorsal interossei. The dorsal interossei abduct, so there are abductors of digits 2 through 4, and we can kind of get an appreciation for why they help with abduction of digits 2, and that's because they do have an attachment on the second metatarsal phalange. And so they are abductors of digits 2 through 4, and then they also help with flexion of the metatarsal phalangeal joint themselves. So those are the 4 layers of the foot. If I were to put all the layers back in, again, it is a total of 14 different muscles supplying the plantar surface of the foot. And so we'll wait for that abductor hallucis tendon to load, and then the flexor digitorum tendon as well. And so here is the plantar surface of the foot. As a whole, we'll talk about what these muscles do, or what role they serve in terms of the structure and the function on the sole of the foot. But that is a 3D anatomy analysis of the plantar surface of the foot. So throughout this online lecture, I've basically described the individual actions of the 14 different muscles of the plantar surface of the foot. But I think it's most important to say that their primary function as a whole, the intrinsic muscles of the foot, really act collectively to resist forces that stress the arches of the foot, so the medial longitudinal arch and also the transverse arch as well. And so the major role of the foot intrinsics really is to kind of reduce the amount of pes planus or excessive amounts of foot pronation in an attempt to allow that foot to be not only rigid but also mobile when you need it to be. And so we can thank the foot intrinsics for really truly providing the support and integrity to the plantar surface or the sole of the foot. So this concludes the online lecture for the plantar surface of the foot. I'm hoping that after watching this, your dissection into the plantar surface of the foot and your discovery of the plantar aponeurosis and the 4 intrinsic muscular layers really would be fruitful now that you've had an introduction to the muscles and the anatomy of the plantar surface of the foot. Looking forward to seeing you guys in class. Have a wonderful day.